the room here for a second.
All right. So our program is called, or project rather, is called Evaluating and Valuable Rapid Assessment of Gender Equality. Program involved this, and we'll introduce ourselves individually since you're not able to see us all. But my name is Amanda, and I'll walk you through the beginning stages of our project. So we began our project.
Amanda, can you move the mic closer to you?
To identify gaps in our monitoring and evaluation systems, to create user-friendly tools, and to assess the gender impact. And the fourth one that we added following January travel was to build the capacity of local THP staff to use the new tools, both in the context of this project and to take them going forward once we finish our collaboration. In addition to THP's understandings of gender equality and empowerment, we use two additional frameworks for this project. The first one is a MARTA sentence capabilities approach, in which meaningful development implies the expansion of a range of choices available to an individual. And when working on women's empowerment, we use Naila Kabir's framework, in which empowerment is a process through which disempowered women gain a greater ability to make choices in their own lives. And so I'm going to hand it over to Walker Pugh, who will walk you through our project methodology and show you the different stages.
Thanks, Amanda. I'm Walker Pugh, and I'll be walking you through the data collection methodology that used for the So on one slide, we divide the methodology into three phases, which correspond to the primary method we used during that phase. The aim of the January field trip was to deepen SIPA's team's understanding of the THP's mission in Bangladesh, to collect information about gender issues in the communities that THP serves, and to inform the construction of the household gender survey. During the January field trip, the SIPA team worked with THP staff, volunteers, and mindset to interview key stakeholders, conduct site visits, and conduct interviews. Following the January field trips, the team collaborated with THP Bangladesh staff to utilize the findings from the focus group discussions and from the interviews to refine the survey. In February, the THP volunteers conducted the survey. Our intention was to capture gender-related outcomes on a more representative scale. The aim of the second field trip was in March, and it was to provide greater context and detail in order to triangulate the findings from household surveys and to supplement it with stories. 8 focus groups were conducted. Given the limited time in the field, this was the maximum we could do. The focus groups consisted of an average of 10 participants whose ages ranged from 15 to 70. A total of 20 activities conducted in January and March, and they were divided into THP and non-THP groups, and they were separated by gender. Our focus groups with THP volunteers are divided according to the THP involved in order for us to better assess impact or differentiated impact. First group hunger will participate and participate. Our focus groups with non-THP individuals were carried out in non-THP unions as well as THP unions. In the THP unions, we were not able to conduct the focus group discussions with the non-THP men, simply because of logistical reasons, but we were able to conduct the interviews. So some of the questions we asked of the focus groups to both men and women were, what does gender equality mean to you? What are the major challenges that women in your community face? What would your life be like if you had never become a THP volunteer? The survey contained 47 questions, and it took 30 minutes on average to complete. THP staff and volunteer enumerators conducted the household survey in 1,400 households in 35 unions. 1,311 could be included in our analysis. The respondents were limited to those aged 16 and above, and we had a target of 40 respondents from each union, 20 respondents who had participated in some type of THP program, and another 20 who had not participated in any of these training programs. Once an enumerator successfully locates a THP respondent, she then goes over to the house immediately adjacent and to the right of the THP house that we just visited, and that was identified as a non-THP household. In this way, each THP respondent was paired with a corresponding non-THP respondent who we can assume to share similar backgrounds. And we did this to ensure comparability. So we had roughly an equal number of THP and non-THP respondents. Due to the response rate, our sample breakup of men and women is 47.5% women and 52.5% male. The survey instrument is divided into 10 sessions, and we have 4 household responsibilities, decision making, rights, and community action. To give you an idea, here are 2 questions from the survey. Can you go outside the house without asking for permission from another family member? And for the last election, were you able to vote for the candidate of your choice without the influence of other family members? That sums up our data collection methodology. Aaron.
Thank you, Lakrika. We fortunately were able to get a lot of information, both quantitative and qualitative. We won't have time today to talk about all the different pieces, so we're going to focus on especially mobility, earnings and spending, early marriage, and then a little bit on the decision making. So these slides have a lot of information. I want to take just a moment to orient you to the way that it's represented so you can start to see the trends that started to emerge from the data. Each bar represents a category of respondent. So the dark green is non-THP men, the light green is THP men. And then in the kind of peaches hues there, we have the dark orange are non-THP women, the kind of peach color are all THP women, and then the pink on the far right are women leaders, which is the program within THP Bangladesh that specifically focuses on gender equality and women's empowerment.
Sorry, Aaron. I'm getting requests for you to either speak louder or get closer to the microphone.
Okay.
Thank you.
Great.
Sorry for the interruption.
No problem. I'll try to speak more loudly. So each set of bars represents one individual question from the survey. So the first one here says, support equal mobility for women. And the question was, do you feel that women should have the same ability to move around outside the home as men? And you can see that in general, women in the peaches are more supportive of this idea than men. But you can also see in that the light green is higher than the dark green, that more of the THP men are supportive of equal mobility than the non-THP men. And within the women, you can see the breakdown as well, that THP women are more supportive than non-THP women. The second question was, are you able to move around outside the home without asking for permission? And again, obviously, you can see that more men are able to move around outside than women, but also within the women, you can see the breakdown that the THP women are more likely to have that ability than non-THP women. The third question there is, so we didn't have baseline data. So in order to try to capture a change over time, we've constructed several questions which would ask, think back to some number of years ago. And that number of years changed based on the number of years that the THP respondent had been involved in THP. So if we had that data, if we knew that they had been in THP for 3 years, we asked, think back to 3 years ago, how has your ability to move around outside the home changed over that time? Has it increased, decreased, or stayed about the same? And so what we see is for the number of respondents who indicate they have a greater ability to move around outside the home without permission, you can see that the same kind of stair-step pattern where the non-THP women are the least likely to indicate that they had an increase in mobility over that time. But all of the THP women are higher than that, and then women leaders who receive the most training in terms of women's empowerment are the most likely to indicate an increase in that mobility over that time period. I now feel more confident moving around outside the home. This was a quotation that came from one of the focus group discussions with the women leaders, where they talked about because of their increased participation in the program, the training that they received, the interaction with the other women, they now feel more comfortable moving around outside the home and interacting in their community. So this was one way that our qualitative data helped to support the quantitative findings, and also helped to give us the impression that not only were these groups different coming in, but there was a change over time based on the programming that they received. This slide breaks down the same questions by program. So we didn't go over it in depth yet, but besides Women Leaders, there are two other programs that we looked at specifically. One is Youth Ending Hunger, which is a youth program, and the other is PAR, which is Participatory Action Research. So that's kind of their program that's aimed at the poorest of the poor to try to empower them and give them the skills to change their own community. So when you look at it like that, you can also kind of see that obviously the THP overall is more empowered and more progressive than the non-THP. And among what we found was that women leaders and PAR were even more in that direction than youth leaders or the overall THP participants. So the next content area we have here is earning and spending. The first question was, do you earn money? And you can see that obviously men are more likely to earn money, but you can also see the same stair-step pattern whereby women likely than their non-THP counterparts, and women leaders are even more likely than the average THP woman to answer yes to that question. The second question is, are you able to spend that money without asking for permission from another family member? So are you able to spend your money independently if you earn it? And you can see a similar pattern that emerges from that data, even with women leaders being more likely to indicate that they are able to spend that money than the men in their communities. And then the last one was, how is your ability to change that? How is your ability to spend that money changed since THP became involved in your community? And you can see a similar pattern there. When I started earning money, my family respected me more. This was a quote that came from a focus group discussion with THP women animators, and it's another. So what they were talking about, and it's women, so women THP animators, where they talked about not only through having this new income-generating activity or participating in that and bringing in money, it's not only a source of income, but it also gives them a greater sense of value and a greater sense of respect from the other people in their family. So this is a situation where the qualitative data allows us to get a richer picture of not only what is happening, but what it means in the lives of the people that are there. Okay, so then, go back. So this is then broken down also by program, and you can see a similar pattern whereby the women leaders and the participatory action researchers are even more likely than the average THP woman to respond positively to those questions. Early marriage. This is an area that THP Bangladesh has identified as really key to their programming there. It's a serious problem still in Bangladesh. And so the first question was, are you aware of an early marriage occurring within your community over the last year? And between 40 and 50% of all the different categories responded positively to that question. The second question was, have you done anything? Have you taken action to prevent a marriage of that kind in your community over the last year? And you can see that among the men, THP men are much more likely to have taken that action than non-THP men. And within the women, you can see the same stair-step pattern where even over 70% of the women leaders who were surveyed indicated that they had taken some action over that last year. The third question there is, have you been successful? If you've taken that action, have you been successful at actually stopping an early marriage? And you can see the same, it's difficult to do, so the numbers in general are lower, but the pattern is still there, that THP's volunteers are more successful when they do take action, and even women are generally more successful than men when they go ahead and take that action. We learned from the trainings that early marriages are harmful to women's health, so we started a campaign. This is a quotation that came from a focus group discussion we did with a group of male THP animators. So men who had not only got the knowledge of the impact that these early marriages have on the lives of young women in their communities, but also were empowered to take action to try and solve that. So this is a situation where I think it really illustrates the idea of how THP envisions its programs the impact that it has in the community, that not only giving them the information, but then empowering them to take change to take action within the community for sustainable change over the long term. So that was something that we really like to see. Again, our qualitative kind of giving context and supporting the quantitative gaps in the system. So by program, you see a similar thing. So that, well, with a little bit of variation there between the PAR and the THP volunteers in general. But one thing that we need to point out with the program data, when we've broken it down, although our overall sample size is quite large, the number of respondents that belong to each one of these different groups was much, much smaller. So we're not nearly as confident about these claims. What we see there is encouraging, that the more training that you get, the more likely you are to respond that way. But we can't be as certain in terms of statistical power based on the smaller sample sizes. Okay. Gender equitable decision making. So the question we asked was, within your household, who is most likely to, who has the primary responsibility for decision making when it comes to the children's education, daily shopping, and then also major purchases? And the options were either men, women, or both. And here, this was the one finding that we thought was kind of surprising, and we'll address it later on in our recommendations as well, is that by a small margin, but still significant, the THP men are actually less likely to respond both, that there's equitable decision making within the family, than the non-THP men. So that was the first, the only kind of finding that we had that was a little bit, that we couldn't really explain based on our focus group discussions. But that is there. Within the women, it's also within THP women are more likely to report gender equitable decision making within their household than the non-THP women. Okay. So just to sum up then, from our quantitative data, we found that THP volunteers are more likely to support women's rights. They're more likely to take action within their communities in terms of issues related to gender equality. And THP women themselves are more empowered in terms of mobility and earnings than non-THP women. Our qualitative findings back up those, the quantitative findings, and also give us good evidence to believe that the differences that we found are not only based on selection by those groups were different coming in, but we have a set of baseline data to compare to. So as we mentioned, we tried to kind of configure some of the questions to try to capture that, but that still kind of limits the conclusions that we can draw based on our data. Now, comparability of groups, as Lakurku mentioned, we tried on this neighbor-based matching approach to try to get a comparison group and a treatment group to try to draw comparisons between those two. But we're making an assumption that those two groups are similar in terms of wealth, in terms of education, in terms of access to other resources within the community, which seems reasonable, but we don't have a way to really figure out how comparable those two groups are. Sample sizes, as I mentioned, with the programs, they got very small. Between 20 and 60 out of our total population were in our, so the results are encouraging, but it's harder to make stronger conclusions there. Limited time frame, we have 5 months. We were on the field for about 4 weeks total between the two groups, so there's a limited there capacity to really catch those changes. And then selection bias. It's impossible to really tell, since we don't know what the groups were like coming in, how much of this difference is due to the differences coming in and how much of it is due to THP's programming. Also, with our qualitative data, it came from focus group discussions where THP volunteers and staff helped to organize those focus group discussions, so we're not really sure how representative those groups of people are of their entire community. So that's also a limitation in terms of the data that we have. I'm going to pass it off then to Ritika to talk about steps moving forward and also the process of the M&E system and evaluation.
Thank you, Aaron. So based on our quantitative and our qualitative analysis, we outlined some next steps for THP Bangladesh. First one was collecting more data. So impact is really broad, and we think we captured some information here, but there's a lot more that THP could capture. So more data is definitely a good thing for THP Bangladesh to have. In addition to that, there's also outcome level data. We collect more of that, and that I'll get into a little bit later. The next thing is more time. So if you capture more data, you need to spend a little bit more time on it, whether it's on an annual basis, whether it's through the monthly meetings. So there's definitely that aspect as well. And the last is an improved M&E process. So capturing more data, spending more time in it, and improving your M&E process to make it more efficient in terms of capturing this information, but also capturing relevant information. And that takes me to the findings that we had. So that takes me to the findings that we had regarding the existing M&E system in Bangladesh. So one of our objectives was to identify the gaps in the M&E system, and to understand that, first we have to really invest some time during our January field visit to understand what the existing M&E system is like, what the process is like, how data is collected, how it's entered into the system, and how it's actually used. So in terms of planning and design of the system, there are definitely some established forums which THP Bangladesh has to capture information. So every program has monthly meetings, and at these monthly meetings, volunteers and the coordinators at the area and the regional level spend a significant amount of time collecting information from them. The other thing is that in terms of the M&E matrix, in terms of indicators and outcomes, the system that they have currently is not really linked to that. So most of the information that's captured at these monthly meetings is in terms of what are the issues in your community, what would you like to do to it, versus this is what THP does, and these are the kind of outcomes and indicators that THP also wants to affect, and kind of combining the two of them. In terms of process, at this monthly training, the volunteers are given paper forms which capture their plans for the upcoming month and their achievements in the past month. All these achievements and plans are taken by the area or louder? Yeah. Okay. All these plans and achievements are captured by the area or the regional coordinators, and they're compiled into one paper form. That paper form is then sent to the Dhaka M&E staff. There are 6 people currently working in Dhaka on specifically M&E, and the Dhaka people manually enter all of that information into the system, and the system kind of presents a summary to them of all the activities that are being conducted at the union level, and then they kind of translate that in, they use that in different ways, such as generating monthly reports, which are used by the management to give feedback to the area or the regional coordinators or the union representatives. There's also quarterly reports which are generated, which are sent to the THP Global Office, and then it's used in communication purposes like newsletters or, for instance, when the country director goes out and talks about THP. So we can see from here that there is definitely a really comprehensive system that's put into place where information is captured right from the level of the volunteers at the community level. It's taken up to the Dhaka office, and then it's entered into the system, and then it's used in some way. So all the information that's collected, and there is a lot of information that's collected in this process, is very systematically captured, and it's used to some extent. The question, sorry, if you could go. The question remains whether all the information captured is strategic and it's relevant for THP. The other question is also how THP Bangladesh can actually combine the information that's collected through this system and the information that they need to understand more of their impact through this system. And so that kind of takes us to the gaps and the opportunities in the system. Okay, so one of the gaps that I mentioned was the relation with the M&E matrix, and a lot of information captured, but I mean THP needs to evaluate whether that information is strategic and relevant for them. The other thing that I missed in the previous slide is that all the information that's captured in these plans and achievements is mostly output information. So there is a separate outcome form which is distributed, but outcome level information is not received as much. I mean, outcomes will not take place as frequently as outputs, which is given. But the kind of effort that's put into capturing those outcomes and really following up on it, the way that the outputs are followed up on, is something that THP needs to look into as well. So the first gap that we found is staff capacity. when we were down in January, we were conducting some focus groups and some interviews to kind of inform our survey questions, testing out the survey instrument. And that's where we realized that the staff capacity in terms of using these tools, using focus groups, using interviews, conducting surveys, that's definitely one gap that we identified, which we kind of tried to address during our March field trip as well. And the other is staff capacity in terms of using data entry tools. So the system that they have, they know really well. They know it inside out. They know what to do with it, what kind of information is captured. But anything over and above that, like using SurveyMonkey, for instance, using Access, that kind of information is not really there among the M&E staff who work very specifically on this. The next is limited resources. So, I mean, currently PHP has such a systematic way of capturing everything. So to invest more time and more resources in conducting focus groups, conducting annual surveys, for instance, conducting interviews will take up a lot more resources than they have currently. And so financially and I mean in terms of human capital, they're kind of limited there. The other is the M&E matrix is still in the developmental stage at the global level and at the local level in PHP Bangladesh. So as long as it takes for them to identify the exact indicators and outcomes that they need to capture, the whole M&E cycle is kind of dependent on that, so that might be a limitation. And then is logistical constraints. So when we were down in March and in January, we noticed that there are a number of logistical constraints in terms of power cuts, limited internet access, the number of computers that they have. And this is especially a problem that we noticed when they were doing data entry from our surveys, where they just had limited number of computers to actually do it, to get more volunteers to do it, as opposed to PHP staff doing it. That said, there are also some strengths that we identified. One is the whole dedication with which all of this information is so systematically collected and used, and 6 M&E staff who are just dedicated to putting all of this information into the system by the end of every month, so that all of it is available for everyone to see and to use by the end of every month. And also the kind of resources that they put into it. So that dedication to having that information, to understanding the purpose of collecting information systematically is definitely there. Then I also mentioned the bottom-up collection of data. So collecting information right from the volunteers and taking it up to the Dhaka central office and then using it over there. So the volunteers are accustomed to giving information, to thinking of plans and achievements, and providing activity level information at these monthly meetings. And at the same time, PHP has now a way of collecting information from the bottom-up level. So that's definitely a strength. And then is activity level monitoring. So as I mentioned, most of the forms that are distributed capture the outcomes. So they know what practically every volunteer is doing in every union, which is a lot of great information to have and to understand how much each union has achieved or not achieved. So they can always go back to a union representative or an area coordinator or regional coordinator and say, look, you haven't managed to finish these achievements that you planned out, or you have gaps over here, and so you need to increase your activity levels in this area. So that's definitely a benefit for them. Keeping these gaps and strengths in mind, the opportunities that we've identified is in the data collection, so in the kind of data that's captured, but also the process by which the data is captured, and moving from paper to electronic form. So there's a lot of manual information that's collected and entered into the system right now. And as we understand from our conversations with the global office, there are options out there, more advanced technical options that they could use that would make their lives much more easier, one of which is iForm Builder. So that's definitely an opportunity out there. The next is using the data to update programs. So during the focus groups, we were able to understand a lot about what kind of messages volunteers were receiving from the trainings, what kind of value they received from the trainings, what action they took. And if this information is captured and used by PHP to really inform its programming, that would be really helpful for them in terms of the delivery of the messages, updating any programs or any particular issues that they want to talk about. So that's definitely another opportunity out there. Which brings us to the recommendations. Okay, so the key overarching recommendations that we found regarding the M&E system and the program content. The first is recognizing the value of an effective M&E matrix. So in our conversations with the management staff at PHP Bangladesh, we understand that they have a top-level understanding of what an M&E matrix is meant to do, of the different content of the M&E matrix. But there's two aspects to this. One is translating the M&E matrix into the M&E cycle and the system that they have. And the second is being able to communicate those outcomes and the indicators to the rest of their staff and to their volunteers as well. The next is establishing clear expectations between the global office and between THP Bangladesh. So right now, THP Bangladesh collects a lot of information, a fraction of which is used by the global office. So having more clear expectations in terms of what is relevant for global and what is relevant for THP Bangladesh, so they can capture that kind of information. Then is updating all the relevant parts of the M&E system. So while the process is established, as the outcomes and the indicators come up, the system that they have to collect information will need to be revised a bit in terms of the forms that they use at these monthly meetings, how the online database is going to be shaped. The whole cycle of the M&E system kind of needs to be adapted to what they come up with the M&E matrix. The next is identifying and maintaining feedback loops. So capturing information from the volunteers and the community and taking it back to them will help them improve their program content and will also improve the implementation of their programs. And the last is adapting program content to reflect the findings, which I've already spoken a little bit about. So with that, I will hand it over to Lisa to go over more detailed recommendations.
Okay. So I hope I'm speaking loudly.
I'll hear if you want.
Okay. All right. So to contribute to the fifth key recommendation that Ritika just mentioned, adapting program based on the findings, we wanted to we've come up with two program-related recommendations for THP's consideration. The first is decision-making in the household for THP's volunteers. Our survey data shows that male THP respondents were less likely to report shared decision-making for purchases compared to non-THP respondents. And so if these results are a reflection of reality, then it's a bit discouraging to see that, especially if THP hopes to see differences in the lives of their volunteers and their families due to the training that they receive. And so our recommendation is to conduct focus group discussions or other activities to better understand the whole decision-making process that takes place in the household, with the goal to see how decisions are first made, by whom, why women may be excluded from that process, and how they can be empowered to have more say. And then to use that information to then modify and adjust or create new program content to address this. And we want to especially emphasize educating and empowering men to contribute to gender equality in their own families. Our second area is economic empowerment for women. In focus group discussions with both men and women, they've defined personal earnings as a vehicle for greater empowerment, a step towards greater empowerment. But unfortunately, in our survey results, there was no statistically significant association with earning your own income and THP participation. And so our recommendation is to either offer more skills-based trainings related to income-generating activity, or if that's outside of THP Bangladesh's scope, to partner with the NGO. We saw that ASHA, Microfinance Institute, there was a positive correlation there to focus on economic empowerment activities and providing the opportunity for the volunteers. So in terms of our M&E system recommendations, we took an approach called learning by doing. So we recognize that a complete overhaul of the M&E system is both daunting, frustrating, challenging, and so we wanted to take a step-by-step approach where we first provide training for a component, and then you go and apply that. And so before getting into that, I want to cover 4 assumptions that we're working under. The first is that THP Global Office is committed to developing the capacity of their country office staff, and they will allocate the appropriate resources to do so. The second is that, like Ritika had mentioned, the M&E matrix will be instituted as an important tool for planning and monitoring. The third, THP Bangladesh will move forward with developing an annual survey to measure impact, similar to the one that we implemented back in March and February. And finally, THP will move forward with absolute commitment from the beginning to the end of the recommended process, because as I said, it's a step-by-step approach. So if you just go halfway, then everything kind of unravels towards the end. So our recommended THP M&E cycle. So we have 9 components here, starting with the M&E matrix. The capacity building training that we recommend is having a follow-up on the log frame approach training that we had earlier in March. Also, a theory of change training would be helpful. And both of those would feed into better understanding the M&E matrix, like what is it, how are we going to use that for programming, and I feel like this first stage is very important because it sets the stage. It's going to it discusses what kind of information that THP will be tracking and how they'll be tracking it. Next, we move on to system process revision and also data collection tools. The capacity building trainings we recommend are revision of the current M&E process and developing those tools, surveys, focus group discussions, interviews, forms, etc. Next, we move on to data collection and data entry. And the trainings that will be needed will be how to use those tools, how to facilitate a focus group discussion, and then how to use a data entry system. In March, we used SurveyMonkey, but we don't know if that's going to be the appropriate platform, depending on what THP Bangladesh decides in terms of data collection tools. And then moving on, data analysis and program evaluation. How to analyze the data, how to use statistical software, or be it Stata or Excel, how to analyze the qualitative findings, and then using those results to inform programs, and then tying that into program evaluation, how to improve the current content. And lastly, reporting and feedback loops. In addition to the internal reporting that already takes place, I guess this is more of a communications piece, but storytelling we thought might be a good way of both closing the feedback loop in terms of sharing information back to the community level. And we also see it as a powerful way of sharing the lived experiences of volunteers. What is translating those outcome level data into actual personal stories that people can relate to and understand, I think is important. And we have more information on that in the annex of our report. And again, information flow and feedback loop. So we envision the trainings happening starting from the global office down. So global office will train DACA, and then DACA will then train relevant information for their area coordinators and their regional coordinators. And then where applicable, they'll also share that information with the volunteers. And not only is the information flowing down, but up from bottom up, where volunteers and area coordinators can play a more pivotal role in revising the current M&E process and also in terms of program content. So that wraps up our presentation. We'd be happy to take more questions, but first we'd like to acknowledge all of these people that have been so vital in terms of completing our study and our research. We'd especially like to thank John and Carolyn. Both have been so invaluable. Thank you so much. And our team in Bangladesh, they kind of make up like half our team really, because they've been so crucial in terms of data collection, data entry. So we'd really like to thank them. Hello, Donabad. So thank you so much, and we'd love to take questions now.
Yeah, thank you. I think that, give me just a second. I'm going to try to pull up our colleagues on video now, and I think I'll point the camera this way. You guys might have to squeeze in, or Aaron, you're just going to hang off the side. Yeah.